Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Think about this for a second. That phone in your pocket, the one you look at, I don't know, dozens, maybe hundreds of times a day.
Yeah.
Could it be doing more than just, showing you messages and videos? Like, what if it's subtly messing with your focus, maybe even changing how your body reacts, and you don't even realize it?
That's a really potent question, and it gets right to the heart of what we're digging into today.
Yeah.
We're going to explore some pretty compelling new research that looks at exactly that, how easily our phones grab our attention, and the surprising links to our own physical awareness.
Exactly. We've got this recent paper. It's in communication psychology and also a health news piece from Medical Express. They both cover this really fascinating work from Hokkaido University.
Okay.
So our mission really for this deep dive is to unpack it all. We want to help you understand how your phone habits might be influencing your concentration, maybe your body awareness, and why that actually matters.
So let's jump right in. The study itself, what were the researchers trying to figure out fundamentally?
Well, basically, they wanted to get a handle on the relationship between smartphone use, attention where focus goes, and how our bodies respond physiologically.
Right.
And they were especially interested in this idea.
Yeah.
Do people who get easily distracted by their phones also have maybe differences in how aware they are of their own bodies, their internal signals?
Okay. Interesting angle. So how did they actually go about investigating that? What was the setup?
So they got 58 healthy young adults, had them do a visual task on a computer. Pretty simple, just spot letters on the screen quickly.
Standard attention task, yeah.
But here's the twist. While they're doing this letter thing, other images pop up in the background, images that are supposed to be irrelevant. Sometimes these background images were smartphone related, like a picture of an incoming call alert or a chat screen. Other times, just scrambled pictures, basically visual noise. That was the control.
Got it. So comparing reactions to phone cues versus neutral stuff, did they keep the main letter task the same difficulty?
No, and that's key. They deliberately varied how hard it was. Sometimes it was easy, like find the X when all the other letters are O's.
Low load, we call that.
Right, low perceptual load. Other times, it was harder to find the X among a bunch of different letters, like chi, M, V, Z high load.
Makes sense. So they could see if being mentally busy on the main task made a difference to how distracted people were by the phone images.
Exactly. What were they measuring while people did this?
Good question. They took a pretty comprehensive approach. First off, reaction times. How quickly did people respond to the letter task under these different conditions?
Okay.
And based on those reaction times, they used a clustering method, basically, a statistical way to group people, and found two distinct groups emerged.
Two groups. How did they differ?
Group 1 only got distracted by the phone images when the main letter task was easy, the low load condition.
Okay, so when they had spare attention, basically.
Sort of, yeah. But Group 2, they were consistently distracted by the phone images. Didn't matter if the task was easy or hard. Their attention just seemed really drawn to those phone cues.
Wow, okay. So like an automatic attentional bias towards phone stuff for that second group.
Precisely. It suggests they had a harder time filtering out those distractions, even when they needed to focus. But that wasn't all they measured.
What else?
They also had everyone fill out questionnaires. One measured something called interoceptive awareness.
Interoceptive awareness.
Yeah.
It's about tuning into your own body,
Yeah.
right? Like heartbeat, breathing.
Exactly. Your ability to perceive and understand internal bodily sensations. They used a scale called the Multidimensional Assessment of Interoceptive Awareness, looking at things like noticing body signals and trusting them.
Noticing and trusting.
Okay.
And another questionnaire measured self-reported smartphone addiction, using the smartphone addiction scale short version, basically asking how dependent people felt on their phones.
So self-perception of addiction. And any physical measures. Yes. They also measured physiological reactivity by recording heart rate changes using electrocardiography while those background images were being shown.
Ah, so looking for actual bodily responses to the cues. Quite thorough.
Very. Behavior, self-report, physiology. So what did they find? What were the main takeaways?
Okay, this is where it gets really interesting. First, about half the participants fell into that consistently distracted group. Their attention was snagged by the phone images, even when irrelevant.
Half. That's quite a lot.
Yeah, and maybe not surprisingly, this group performed worse on the attention task itself, slower reaction times when those phone images were around.
Makes sense if they're being distracted.
But here's the really compelling bit. This consistently distracted group also showed an increase in their heart rate when the smartphone images appeared.
An increase. So, like, their bodies were reacting more strongly, more aroused or alert.
It seems like it. A greater physiological reactivity specifically to the phone cues, and then there's the connection to body awareness.
Ah, yes, the interoception questionnaires. What did they show?
This is maybe the core finding. That same consistently distracted group reported significantly lower interoceptive awareness. Specifically, they scored lower on the noticing and trusting aspects.
So, less aware of their internal state and less trust in the signals their body was sending.
Exactly. And to complete the picture, this group also scored higher on the smartphone addiction scale.
Wow. Okay, so let's piece that together. The people most consistently distracted by phone images were also less aware of their internal body cues, trusted those cues less, and reported higher levels of smartphone addiction and had a stronger physical heart rate reaction to phone stimuli.
That's the cluster of findings, yeah. It paints quite a picture.
It really does. Did they see anything different in the other group? The ones only distracted when the task was easy?
Yes. Interestingly, that group 1, actually showed the opposite heart rate response. Their heart rate tended to decrease slightly when they saw the smartphone images.
A decrease. That's fascinating. So, completely different physiological signature. Acceleration in one group, deceleration in the other.
Right. The researchers interpret the deceleration as maybe more of an orienting response, like they noticed the image briefly, but it didn't trigger that strong attentional capture or physiological arousal seen in the other group.
That divergence is really striking. Okay, so let's talk implications. What might this mean for, everyday life for someone listening?
Well, it makes you think, doesn't it? If you find yourself constantly reaching for your phone, almost on autopilot, or easily pulled away by notifications,
Yeah.
this research suggests it might not just be a bad habit.
It could be deeper than that.
Yeah, it could be tied to maybe having a lower awareness of what's going on inside your own body, or maybe having a stronger, almost unconscious physiological reaction to anything phone-related.
So, like, if you feel a bit antsy or bored, instead of registering that feeling internally?
Someone with lower interoceptive awareness might just default to grabbing the phone, maybe without even consciously processing that initial internal feeling of restlessness. It becomes the go-to action.
That makes sense. And the researchers themselves pointed out some parallels, didn't they, to other kinds of behaviors?
They did. They noted that the patterns in the consistently distracted group, that strong attentional pull towards cues, the altered physiological response, have similarities to what's observed in behavioral addictions.
Like gambling or even substance use issues, where specific cues trigger strong reactions and attention biases.
Exactly. It raises the question, is our constant phone use kind of training us? Training our attention towards the external, the digital, maybe at the expense of noticing the internal.
And if you're less aware of your body signals, maybe signals of stress or fatigue or even positive emotions, perhaps you become more reliant on external things like your phone for regulation.
Right. Or just for stimulation or coping. If you feel anxious, but you don't really register the physical sensations of anxiety clearly, maybe scrolling becomes the default way to numb or distract from that vague discomfort.
Creating a potential feedback loop, maybe? Less body awareness leads to more phone use to cope, which maybe further dampens body awareness?
It's a plausible cycle, definitely something this research points towards as a possibility. It's quite thought-provoking.
Absolutely. Now, like all studies, this one has its limits, right? We should probably touch on those.
Definitely. For one, the participants were all healthy young adults in Japan. So we need to be a bit careful about generalizing these findings straight across to, say, older people or people in different cultures where phone use might be different.
Good point. Age and cultural context definitely matter with technology use.
Also, the smartphone addiction part relied on self-report questionnaires, people saying how addicted they feel.
Which is useful, but maybe not the whole story.
Right. Future research could benefit from adding more objective data, like actual screen time stats from the phones themselves.
Yeah, combining self-report with objective usage data would be powerful. What about the stimuli they used?
The phone images were illustrations, like drawings of typical phone screens. So another question is whether the effects are specific to those kinds of visuals, or if it's a broader response to anything tech-related, or even just the physical phone itself.
Fair point. And crucially, this study shows a correlation, an association between these things.
But it doesn't prove causation. It doesn't definitively say lower body awareness causes more distraction or vice versa.
Exactly. We'd need longitudinal studies for the studies that follow people over time to really tease apart how these things influence each other as they develop.
And one last technical note. They mentioned they couldn't get usable electrocardiography, the heart rate data, for all participants due to some issue.
Okay. So the heart rate findings are based on a smaller subset.
Yeah, still interesting, but important to note it wasn't the full group for that specific measure.
Okay, good to keep those limitations in mind. Did the researchers themselves comment on the bigger picture?
Yeah, the lead author, Yusuke Haruki, was quoted in the Medical Express article. He mentioned that this work grew out of an interdisciplinary interest, sort of philosophy meets psychology, looking at the technology-body relationship. He apparently found it surprising how little we actually know about how smartphones, which are so central to life now, influence our awareness of our own bodies.
It is surprising when you put it like that. We use them constantly, but the link to our internal state isn't often discussed.
Right. And Haruki specifically wondered how just paying attention to phone cues out there in the world might shape our ability to sense what's going on in here, inside us.
That's a really fundamental question about attention and awareness in the digital age. Did they talk about applications?
They expressed hope that understanding these connections could help develop better ways to encourage healthier digital habits.
Especially for younger people, maybe.
Yeah, they mentioned that specifically, helping people build a more balanced relationship with their tech.
That seems like a really positive goal. And future research plans.
They mentioned wanting to look at brain activity next, using neuroimaging to see what's happening in the brain when people get distracted by phone cues.
Getting into the neural mechanisms, that would be fascinating.
And also tracking how these patterns develop over time, especially during adolescence and young adulthood when habits are forming.
Makes sense. Understand the development to inform prevention or intervention.
So wrapping this up, maybe a final thought for everyone listening. Just pause and consider. How often do you reach for your phone without really thinking about it? Is it automatic? And based on what we've discussed, could your level of body awareness, how tuned in you are, be playing some kind of role in that pattern?
And are there subtle physiological reactions happening? Little shifts in heart rate or alertness tied to your phone that you just don't notice?
It definitely encourages a bit of self-reflection. Maybe, just take a moment later today, intentionally notice your breathing, your posture, the feeling in your hands or feet.
Just check in with your internal landscape for a minute.
Yeah. And see if doing that, even briefly, changes your awareness or your impulse around your phone. It's just an experiment.
And if this whole topic resonates, there's a lot out there on mindfulness and improving interoceptive awareness. It might be worth exploring.
You could even look up the concepts behind those questionnaires. They used the multi-dimensional assessment of interoceptive awareness, the smartphone addiction scale, just to understand the ideas better for yourself.
Absolutely. This feels like we're just scratching the surface, really, of understanding how deeply our technology interacts with our minds and bodies.
It really does. A lot more to learn.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.